Okay, Shabab. There is some lesion in the spinal cord which is affecting the lumbar region now, okay, lumbar region of the spinal cord, and this is affecting the anterior part of the spinal cord. There is some disease process which is affecting the anterior part of the spinal cord on the left side, anterior part of the spinal cord on the left side, okay. Maybe a tumor, maybe a disease, maybe something else, some growth or anything which is compressing or destroying the spinal cord, anterior surface of the spinal cord, okay, at the lumbar level, all right. The person develops a sensory deficit or a problem in that case. Now, what is your guess? I have given you a brief scenario. Due to some disease, anterior surface at the lumbar level is affected and the person has a sensory deficit in one part of the body, okay. This part is most likely right what? Right what? Right what?
Right side.
Right side means right side. Abdullah is starting from here till here. Right lower part of the body, somewhere in the lower. I said lumbar region. Okay, I specified. All right. I did not say anterior surface of the spinal cord. I said anterior surface in the lower part. So consider something coming below that level. Okay. So the fibers which are being received at below level, okay, they will be affected, and usually in the lower limb, it will be affecting in the lower limb, okay. So right lower limb or the left lower limb? Right lower limb, okay. Will it be a major loss or a minor loss? It will affect the major loss really, okay. So the most likely sensations lost are pain, temperature, crude touch and pressure, depending upon how much area is affected. Is it mainly affecting the anterior spinothalamic tract or it is affecting the lateral spinothalamic tract? But generally it will be a combined effect, and this is how you guess sidedness, that contralateral side is affected, okay. Will there be any effect on the sensations, dorsal column sensations of the right side in this patient? Will there be any defect on the right side? Will there be any defect on the left side? Yes. What is the reason of saying maybe? Because the lesion is on the right side, you are saying? On the left side? That's why? Because if the lesion is clearly telling you that it is only on the anterior surface or the anterior part of the spinal cord is involved and the dorsal part or the posterior part is not involved, in that case, do you think the dorsal column of this side will be affected? No. Assumingly no. So consider the answer as no, as long as you are not getting any clue or any hint for that, okay. So maybe is an answer, but maybe is not answer of our choice in our exams. We never ask about maybe, mumkin, it's not like this, okay. Most likely, will you have most likely problem in the dorsal column? No. Most likely the problem will be anterior lateral column and will be on the right side of the body deficit. Did you get that? Okay, in this way you will go. Very quickly look at the pathways. I am just going you or taking you for the pathways, okay, going with you. See, you are entering from outside. Now look at the green color. Can you identify? I'm sorry, I think coming in your way. So I don't know if you can see that. All of you, can you see that? All of you? All right. All right. So I'm going again, please. Just trace the pathway, the green color, okay, please. You starting now, okay. First order neuron, right? Spinal ganglion. Entering, okay, in the nucleus, okay. It means you are going into the nucleus, synapsing in the nucleus, okay. Now, ascending on the same side or the opposite side? Same side, isn't it? This is what we see. It's not going to the opposite side, all right? It's going up. Posterior spinocerebellar tract. Going up into the cerebellum, of the same side. Okay, now this is something different really, isn't it? Okay, usually tracts, generally speaking, the tracts they cross over. Okay, your ventrolateral system tracts cross over. Spinocerebellar tracts are very special. Okay, I'll tell you why. Cerebellum, okay, and spinal cord. Look at the relationship of the cerebellum and the spinal cord, very important. This is spinal cord, okay, two halves of the spinal cord. This is cerebellum, two lobes of the cerebellum, right side and left side. Okay, now you have to make relation with the cerebellum and the spinal cord. Okay, well, the cerebellum and spinal cord have the ipsilateral connection. What kind of connection? Ipsilateral. Cerebellum is connected ipsilaterally mainly with the spinal cord. It means the right side of cerebellum or the right lobe of the cerebellum is receiving right side of spinal cord, and it is controlling also the right side of the spinal cord. So the control is ipsilateral. Did you get that? So that is a very special point. Be careful about that. Okay.